Hi, good afternoon, and welcome to Lunch and Learn, which is a program sponsored by Family Partners of Morris and Sussex County. My name is Holly Dinnany. I am the facilitator for today's conversation. We like to think of Lunch and Learn as having lunch with an expert on a topic that is helpful to those of us who work to serve families with youth who have challenges and those of us who have youth with challenges. And basically, folks who are just trying to make our community stronger through our families. It is our privilege every week to bring an organization or an expert to the table to tell you about their services or to update you on terminology and conditions and things that are helpful for us to know. And today is no different. So it is a lunch and learn. I am okay if you keep your camera off if you're nibbling, but we do love to see smiling faces. And I see a few. I'm going to shout out to Marcia and Bill, who are already on and on camera. Thank you for that. I will let you know that today's program will be recorded. So we thank our guests for allowing us to record, and we will be posting this on our YouTube channel. And if you have not checked out our YouTube channel yet, I encourage you to do so. We have somewhere in the neighborhood of 50 presentations that we recorded over the past year or so on some really interesting, important topics, and you get to meet some fabulous people doing important work in our community. So we're recording today's program. We're happy to have you with us. If you have questions, I'm going to ask that you drop them in the chat and we will address them at the end of our program. So it is my privilege to introduce, today we have with us Corporal Erica Valvano, who is the Hope One coordinator, who we both think she came and talked to us a while ago about Hope One. But I'm excited because wonderful things are happening in Morris County as I have to give it to Sheriff Gannon's always thinking of new ways to serve our public and keep us safe. And today she's here to talk to us about Hope Hub, which is a relatively new program in Morris County, but has already affected so many lives. So I am going to turn it over to our guest, Erica Valvano, and we welcome you and we thank you for joining us today at Lunch and Learn, Erica. The floor is yours.
Thank you so much for having us with you guys. Good afternoon, everyone. I'm Erica Valvano with the Morris County Sheriff's Office. I am the coordinator of our Hope One program over there, and Sheriff Gannon launched that back in 2017. And Sheriff Gannon always asks, how can we make this better? So in 2021, in March, we launched the Hope Hub. So our outreach expanded even further. I apologize for any background noise. We're actually set up at the Rockaway Mall right now doing Hope One outreach. So if you hear talking behind me, that's what you're listening to. So the Hope Hub came from the idea from a program that actually started in Canada, and Chelsea, Massachusetts adopted the model. So they were on the most dangerous cities to live list. And they said, what can we do so that we can, help our community and keep our residents safe? So in 2015, Chelsea Police Department launched a hub model. So researching it, we've launched Hope One in 2017. We've been out in the community, made over 20,000 contacts. And we said, how do we get services to those specific individuals struggling? And that's where the Hope Hub came into play. So the Hope Hub was launched and modeled after Chelsea, Massachusetts program. So we're actually the second hub model in the entire country. So the hub model basically takes the vulnerable population that we're serving and connects them to services by simply talking to another, to working together so that we can help this person who more often than not has more than one problem, more than one struggle. So if they're struggling with housing, maybe they're also struggling with substance use and things like that. So the hub system brings in social service agencies and we all work together. So we're law enforcement. How can we work with these social service providers, these county providers, because we also work with our Office of Temporary Assistance so that we can provide people with things like benefits, food stamps, cash assistance. So it's really a model for community safety and well-being. We're working to reduce the risk that these people that are struggling, whether they're an individual or they're a family, they can all be part of the hub so that we can help get them on their feet so they can thrive in the community. So our hub here in Morris County is a police-led initiative. So we are made up of Officer Whiting, who is our Hope Hub coordinator. This is obviously Sheriff Gannon's program. And then we work with all the providers to meet weekly. So every Friday we have a meeting so that we can address the needs of all those individuals that came in the week before. So every Friday we are addressing those new Hope Hub individuals or families. What is AER? So acutely elevated risk. So this is where an individual or a family meets a threshold of significant risk factors. So are they at risk of overdose? Are they at risk of losing their housing? Are they at risk of suicide? We know that something bad is going to happen to this person. So let's intervene as a team and get them the services that they need. So that's where bringing these people at an acutely elevated risk to the hub table has really proven successful. So what are the risk factors? I just went over a couple. Everything from basic needs and housing to, are they the victim of a crime? Are they struggling with their mental health, with their substance use, whatever it may be? So we have over 30 providers participating in our hub here in Morris County. So everybody from human services to mental health services to addiction services, youth serving agencies, our Office of Temporary Assistance, hospitals, whoever we can pull together so that we can wrap this individual or family with services and get them the assistance that they need. So the Community Risk Watch, again, it's just the table. We call it the table. Unfortunately, we can't meet at a table because of COVID. And logistically, it's just really worked out anyway to do our meeting virtually. So virtually every Friday, we bring together all of these representatives from these agencies to assess what these people are struggling with and see who can help and what agencies would be the best fit to help them. So a designated representative from each agency comes on. We talk in a structured conversation. We try and keep it 4 minutes per client so that we can go through what are their needs, what are they struggling with, what are their risk factors, and then it is led by Officer Whiting, who goes through each Hope Hub situation. We are up to situation number 96, and we only launched on March 5th, 2021. So we haven't even been operating for a year, and we're up to 96 situations. So the 4-filter process is what we use here in Morris County. It's designed again after the hub model in Chelsea, Massachusetts. So it starts with the referral, and then the de-identified information gets presented. So we have an individual, age range 20 to 30 years old, struggling with mental health, addiction, housing, and is in need of employment. So we go over, is there, we ask the table, is there a significant community interest at stake? Is there a probability of harm occurring or occurring soon? What multidisciplinary approach can we do as a team to address that elevated risk? Once there's a consensus that there is a high probability of harm, we move on to the next level. where we disclose to the agencies that would be involved so that they can, provide agency recognition. Maybe they have worked with the Mental Health Association in the past. Maybe they have worked with the Office of Temporary Assistance in the past. And then once we know what agencies would be involved, we work together to do a door knock intervention. So we actually visit the person and provide them with food, provide them with Narcan, and provide them with the services that are available to help their specific situation. So how long do those services last? Each hub client will be on the hub for about 30 days. The clients will not be revisited. So once they're connected to services, we close out their case essentially. So this program is really benefiting the community by improving community safety and well-being, by increasing collaboration, right? We're all working together to help people. So let's make sure we do it as a team approach, and let's make sure we're able to get those resources out there. And it also really helps for us to know what services each agency provides. So we know that, a certain agency can provide case management for up to a year. We know that another agency can provide clothing and food. We know where we can go to get what we need so that we can help that individual. So the agencies that were involved very early on were Family Promise of Morris County, CARES provides us with our peer recovery specialists, the Mental Health Association provides us with our mental health professional, Navigating Hope is our OTA contact to do those benefit screenings and things like that. I'm gonna show you a video, so just hold on 1 second. Can you see my screen? Yes, okay.
The Hub is a community safety and well-being model that serves two purposes. It identifies individuals or families that are at what we call an acutely elevated risk, and it brings several service providers together once a week.
There was no way that we were going to be able to go forward in helping young people stay out of prison and get them out of poverty and harm's way if we weren't working with other communities, if we weren't working with the police department and the courts. And the Hub brought everyone together, brought everyone to the table.
Being involved with the Hub has helped because we've made a lot of connections. The program means to me being able to help these individuals that wouldn't know where to go or where to seek the help.
Once you get everybody in the room together, you start to build relationships. You start to figure out how I can share this information, how I can share that information, and you're able to put the whole puzzle together so you can provide better services.
So the Hub is a process. It's a process that involves 4 filters. So filter 1 is done outside of the Hub. That is done before the meeting happens, and that's done at an organization or a group that's trying to help somebody get out of risk. They determined that they need to introduce this situation to the Hub. Filter 2 is a de-identified introduction of that individual or the family.
Have a female, age 60 to 69.
Do you want me to replay it? Could you hear it?
Risk factors are diagnosed mental health, currently homeless due to an addiction, self-harm, self-neglect, poverty, and negative peers.
And is there a breathing error?
Sure. So we have an elderly female who is currently homeless due to being evicted for smoking in her apartment. She is missing her appointments and still needs medications, but won't show up for the appointments and is going to need help with housing, but now has an eviction on her record.
So to the group, is there a consensus of a high probability of harm?
Yes.
And is there a high predictability that this harm will continue?
Yes.
And are we crossing several service sectors?
Yes.
Therefore, are we at acutely elevated risk?
Yes.
Filter 3 is when we as a group have reached consensus that this person is at an acutely elevated level of risk, which means that something bad is going to happen if we do not intervene or continue to happen. Then we share very limited information about that individual to make sure that we all know at the table who we're working with. Is this a family or an individual?
Individual.
Okay. And at this point, if you can please list name, date of birth, and previous address.
Anna Smith, 123 Main Street, Chelsea.
Thank you. Is there recognition? Is there awareness of any current service in place? So what agencies should be taking notes relative to the risk factors? Okay. Okay. CAPIC, Housing Support Services. Elliott, Mental Health. Can you maintain the lead? Okay. And are there any further comments on risk factors? Okay, seeing none, the participating agencies will now move to a filter 4 offline session after the general portion of our meeting to discuss further information relative to this situation and to strategize on ways to connect individuals and our families to services. All the other agencies will leave the situation. Thank you very much. Filter 4 happens after the general portion of the meeting. That's when the agencies get together that are part of the Filter 4 team with the intervention team, and they plan on how they're going to do a door knock or some sort of an intervention to offer services to this individual, to this family. Updates happen at the beginning of the meeting, and that is what builds in accountability of updates. So what that means is that we provide an update to the entire table of how the intervention went. Welcome everybody. To start the hub meeting, we're going to begin with updates from the previous week.
All right, situation 485, female between the ages of 70 to 79. This situation was introduced by Cambridge Health Alliance, and CAPIC was taking the lead. This is a family intervention. Some of the risk factors are basic needs, housing, mental health, and physical health, chronic disease. Do we have an update on situation 485?
Yes, I do. I have an update. After sleeping in the car for a year, they are now going to be moving into an apartment in 4 days. 4 days. So they are ecstatic. But other than that, CAPIC's going to help them with their security deposit, and they're going to be finally out of their car.
Based on the update, it sounds that this family was connected to services. So I'm going to go ahead and conclude connected to services.
Great, thank you, Jose. That's fantastic. Thank you, everyone. I think that deserves a round of applause. So what we've learned in Chelsea is that the hub not only has increased our community safety and well-being, it's really supported families and individuals, and they're thriving. They feel supported. It's a small community, and that connection is really important. But it's also created a camaraderie with the agencies in Chelsea. We communicate with each other more, we support each other, we attend each other's events, and that is what is really helpful, because the city operates with the hub mindset. We meet all the time, and we solve problems quickly. Our residents feel confident that if they see a situation that someone's highly at risk, that they know that they can call someone and something is going to happen.
The goal of the hub is to provide support and services. There is no enforcement involved in the hub process. Police officers that work the street 24 hours a day, 7 days a week, always encounter or engage with people that are at risk. They know something bad's going to happen to that individual, to that family. So why wait for the 911 call to come out?
So if you feel that your community is working in silos and you want to work more collectively and communicate more, especially with situations that are difficult, we can come out and train you on how to implement a hub in your
So that is the model that we used here in Morris. So I think the presentation, as soon as I saw that video, I knew. I said Morris County needs a hub model. So it's really, really an amazing program, and that we started it and we're able to bring it here to Morris County has really been, an amazing thing that we're able to do.
Community organizations and police from
I'm playing too many videos at the same time. All right, I'm gonna play one more.
across Kingston, Frontenac, Lennox, and Addington, or KFL&A, have launched a new community risk watch initiative aimed at building safer and healthier communities. Through the rapid mobilization of multi-agency resources and service connections, the Community Risk Watch situation tables will provide support to individuals and families experiencing acutely elevated levels of risk, which is to say they are facing a composite number of risk factors that cut across multiple human service sectors that will likely soon lead to an unsafe or unhealthy situation. These could include individuals that may be at risk of doing harm to others, becoming a victim, relapsing on a treatment plan, or ending up on the street. This KFL&A Community Risk Watch concept is modeled after the now well-known and evidence-based hub model and community safety well-being approach coming out of Saskatchewan, and now in place across Ontario, Canada, and beyond. Why implement this model? For KFL&A, the need and desire to do something different in response to community safety and well-being sparked the interest in this model, and following consultations with experts in this area, the decision was made to adopt this multidisciplinary intervention process. Our communities are great places to live, but more can be done. We already have a long history of collaboration in this community, so this approach builds well on those relationships and experience. How does it work? Designated representatives from these organizations will come together on a weekly basis in each community for the situation table discussion. This is a structured conversation led by the chair, which follows specific guidelines known as the 4-filter process in order to respect the privacy of at-risk individuals. What is the 4-filter process? Filter 1, individual agency screening. This happens away from the table within each agency. Agency or ancillary representatives working within the community can refer at-risk individuals or families to the Community Risk Watch for consideration through the approved referral forms if they feel they meet the required criteria. Filter 2. De-identified information is presented to determine if acutely elevated risk is present while protecting the privacy of the individual and each agency's privacy guidelines. The representatives bring forward the referred situations in a de-identified manner so that the table of experts can determine if the situation meets the next threshold. In order to determine if an individual meets that level, the table asks 4 key questions. 1. Is there significant community interest at stake? 2. Is there a clear probability of harm occurring? 3. Is there a significant intensity of harm predicted? And 4. Is there a multidisciplinary nature to the elevated risk? If there is a consensus at the table that all requirements are met, they move to the next level. Filter 3. Limited disclosure for agency recognition and to determine who should have a role. Limited disclosure of information is presented to pause for recognition and determine if or which agencies are already engaged, and to identify if other agencies should play a role. Filter 4, the door knock intervention. This now moves away from the table so that only the appropriate agencies identified in Filter 3 are involved in the planning. Those agency representatives meet either immediately after or within a short time frame to work together to determine the plan for intervention, which should take place within the next 48 hours. This intervention is not about enforcing or apprehending. It is about offering support and assistance that in many cases was not known to be available, easy to obtain, or accessible to all clients. It is about responding to risk, working to prevent incidences and crises, and doing things differently. The vision behind these risk-based collaborative approaches is to create a fundamental shift in the way society understands community safety and well-being. Through the mobilization and delivery of multidisciplinary services and technologies, we aim to drive proactive, opposite to reactive tactics to promote social innovation. The situation tables are one aspect of a community safety and well-being plan, and we are proud to have launched 2 of these tables in Kingston and Napanee as part of our regional approach.
Okay, so the most important thing that I want you guys to take from today is referring people. If there's an individual or family that is at an acutely elevated risk that you're working with, please refer them. We actually created a QR code that we put on our Hope Hub cards so people in the community can just scan it and it brings them right to the sheriff's office webpage, which has the referral form on it. Or you can just pull up the referral form online, type in Morris County Sheriff's Office Hope Hub, and it'll, just Google search, it'll bring you to the link. The link is provided here on the PowerPoint if you want to take a picture of it. And just, sit with the person and have them go through it so that it's so simple. They can just click off what services they would be interested in. And then from that, it generates an email to the Hope Hub team. And then we now have their Hope Hub situation so that we can bring it to the table on Fridays. So again, very easy, very simple. The referral form is online and you are able to refer people.
Erica?
Yeah.
I didn't invite. I just want to make sure everybody on the call knows, remind you, we're recording this, but we will also, when we send out the recording, I will make sure we have those links in an email that goes along with them, just so that you have them handy. I mean, I really appreciate, Erica, how much you're trying to make it easy. The QR code, you're trying to make it easy for people to access this service. Sorry for interrupting.
No, absolutely. That's what we want. We want to make it as simple and user friendly so that everybody from a provider can refer someone to the person struggling themselves. I've texted people who have reached out for help and I've texted them the link in a text and they go on and they fill it out themselves. So it's really user friendly. We tried to make it that way so that, people that are struggling, it doesn't put up another barrier, right? They can just get connected as easy as possible. So I'm going to put up Chelsea's info. Chelsea runs our Hope Hub here in Morris County. You can always reach out to me or Officer Whiting, and we will, be more than happy to, answer any questions you may have, do a presentation, whatever it takes. But Holly, if you want to start with any questions, I don't know.
Yeah, I'll definitely. I'm gonna say, I see Bill has his hand up. Bill, did you just pop off mute if you'd like to ask a question?
Yeah, I did have a question. This does seem like a great resource for many potential situations. My concern is a couple of cases, theoretical cases. One would be if immigration status is in question with a family who might be a little hesitant to want to get involved if law enforcement's involved, because that could mean something more dire for them, and then another would be anything like involving illegal substances and things like that. Again, a similar concern would be could potentially there be legal consequences for them versus just going to an agency without the law enforcement piece. How is that dealt with?
Sure. So we have had no issues with any of that. We're not checking to see if somebody is here legally or not. So their immigration status would not really come into play. If they do express that to us, we send them to Hispanic Affairs because they are able to address some of the questions that are really out of our realm of things we're able to connect them to. So that has not become an issue, but yes, I can see where you would see there would be a concern. We are in plain clothes, Officer Whiting and I, so we address this as a community issue, and we are not deterring people from coming. We could be with somebody helping them for 45 minutes, an hour, And then at some point they realize, that this is a sheriff's office program, but we've already created that rapport with them. So we're able to help them. And then under Chapter 58, as law enforcement, we are able to help people struggling with addiction. So that's why we have the PARI program, because under PARI, it's our Police Assisted Addiction and Recovery Initiative. So people can come to law enforcement and say that I need help. And if they do have any paraphernalia on them or any drugs on them, they would not be charged. So we're really able to address the needs of people struggling, and really, whether they are here illegally or whether they are actively using substances, we're here to help.
Bill, I thank you for those questions. And I mean, Erica, for me, it's so, many people don't know if you're not in the know, so to speak, but I know even in Sussex County, which is another area that our agency services, I know those officers also have a program that I think might be called CLEAR, which is similar to your PARI, right? I mean, the goal is to connect the individual with services instead of responding in a punitive manner, correct?
Yes, that's correct.
So that's great. And I think we have a Jennifer, and then we'll go to Christine. Jennifer, if you want to pop off mute and ask a question, or you're welcome to.
Yes, I do. So say if somebody is in, so say they have, drug court, and they realize that they're struggling, right? And they don't want anybody to know, because guess what? Guess what happens, right? If they say anything to anybody, so if they were to come in and be like, look, I really need help, is that going to go against them, or how does that work?
No, we actually set up at probation in both Morristown and Dover to help the people that are involved with probation. And then we also work with the probation officers. We've done the same presentations that we're doing here for you today for our probation department, so that they're all aware. And they actually reach out to us as well to say, one of my probationers is struggling, can you get them help?
Okay, so it wouldn't like backfire later or anything like that on them, right? Because I want to be able to help, help people and be like, hey, take a look at this and whatnot, but I also want to make sure that I'm not giving them some sort of information that's, untrue, you know what I mean? And later be considered, that person who lied to them, or you know what I mean? Or that,
we all work together. There's, Hope One is our community model. The Hope Hub is addressing people that are at an acutely elevated risk. The Hope Wing in the correctional facility is addressing people that are currently incarcerated in the Morris County Correctional Facility. So we're really trying to hit it at all angles. We help with Operation Helping Hand as well, which is a post-arrest model. So if people are, a user and they're arrested, they would be connected to a peer recovery specialist, right on the spot. So we're really just trying to work together. So I don't think that that should really be a concern.
Okay, and then I do have one more question. Do you know if they have any services for that in Somerset County? Is that the same kind of thing, or no? Or we don't know? Because I work at all counties, that's why I asked.
Okay, sure. So Somerset County, I actually next week I'm going to be meeting with them. They're looking at launching a Hope One model. Okay. So the mobile outreach.
Is there any way I can get in touch with you next week and be there to listen to what is going on with Somerset County or anything, or be a part of that somehow?
So that's a project design meeting. So I don't know. I can get you in touch with them, and you can, vet that through them.
All right. And then if there's any positive outcome or negative outcome, would you mind sharing that with me, whatever outcome there is? Is that all right?
Yeah.
Erica, if Jennifer emails the address that's on the screen, that message would find its way to you, correct?
Yes. Yep.
Okay, Jennifer. That's great.
Thank you.
Erica, thank you for fielding these questions. There's a lot of interest, as I can understand. And I think next we had Christine has her hand raised.
Hi. I'm sorry I jumped on. I was having difficulty logging on. So so first question is the Morris County Sheriff's Office, like through Morris County, there's one sheriff's office. Is that correct? There's one sheriff's office, and is
Correct.
that okay, so Navigating Hope, is this part of Navigating Hope, or is this separate from Navigating Hope?
Okay. Yep, no, I can totally see where that comes from. So Hope One launched in 2017, going mobile with addiction recovery mental health services. 2019, Navigating Hope launches. They went mobile with housing, food stamps, cash assistance, general assistance, so OTA benefits.
Okay. Okay, so that's okay. So I had it mixed up. So Hope One, that's for like recovery and mental health. I have to tell you, I have a psychology degree, and I worked for a social work position and have just seen a lot. And this is so wonderful that it's like people who have addictions who wind up in the court system and wind up in jail and all that, like really like they just needed help. And
Sure.
this is so wonderful to hear that the world is changing and that people are getting help.
Yes.
And it's just so wonderful to hear that. And that when people, because I think people would be reluctant to try to get help if they have drugs, or if they're on drugs, or if they have a past of court, things with the court, so that they won't get in trouble for the paraphernalia or whatever, that they're going to get the help that they need. Is just so wonderful to hear that. So thank you for doing this. I also I don't know, is Family Promise this? I'm wondering if like agencies like Family Promise, or like some other agencies that are dealing with homeless or dealing with people who have addiction, I'd like to connect them to you. Or
We're already working with Family Promise.
You are? Okay, wonderful. Okay, that's great.
Christine, if you came on late, I think Erica was telling us there were about over 30 agencies at the table. So they're very well connected in the county. And Erica, as you were talking, I'm like, I love that Desmond Tutu quote about, it's okay to be pulling people out of the water, but how about we walk upstream and figure out why they're falling in, right? Like, I just love the proactive approach. And I also, it's a community, and who's more, boots on the ground than law enforcement, as far as it's a role that makes sense, right? As far as partnering closer with the community to get resources where they need to be, which is out in the community, not necessarily sitting in the agency waiting room. So are there any other questions? I mean, Erica, I'm a softie. Anybody who knows me knows that, but watching some of the video clips that you share, which I really appreciate, but I mean, I was welling up with tears. I mean, the amount of resources in one room, and there are so many, for those of you who don't know, and I know we have some of these individuals on this call, there are so many brilliant people doing great work. And the difficulty is not everybody knows about the work that's being done and the services that are being offered, right? So that's why we do programs like this, and that's why we have meetings where we try to share what's going on. But this is just such an important boots on the ground in the community resource to do that. And I know I join everybody else on this call with appreciating everything that you're doing, and just the creativity to be proactive with these things. So thank you very much for your service and your creativity. And are there any other questions on the call?
I have a question again. This is Jenny Combs.
Sure.
So, one of the things that I've noticed that, and I am a previous peer recovery specialist. I don't have personal recovery issue background, but I do have friends who did. So that's why I actually went into it. But so a lot of times when I'm just meeting people, like for instance, when I go and help out with Mom to Mom or whatnot, a lot of people don't want their kids to say anything to anybody about their issues with with recovery or addiction, because they don't want that label to be on their medical records. Do you know what I mean? Because that can be held against them later in the future. Should, and it's true, divorce, custody battles, any of it, get a guardian ad litem involved, and it doesn't matter if it was 20 or 30 years ago, it's on there. And yeah, it can be held against, it's not like Hallmark, unfortunately. But so, have we come up with something yet that where we can, protect, literally, like really truly protect the privacy? Maybe have someone as a number instead of as their actual name, in order to 100% protect the privacy? Or are we still just going by the HIPAA?
So that's a great question. We have each situation is a number. So we're up to situation number 96. So that's how we identify each situation through emails, and when speaking with our partner agencies, we say, hey, situation number 28 needs a wheelchair, situation number 54 needs a Narcan kit. So we're not using their name. But I think the stigma is very real. We've seen it over the last 4.5 years with Hope One. We've had parents drive from Montville to Mount Olive to get Narcan kits because they don't want people in Montville to see them at the truck, or people from Parsippany drive to, Morristown, whatever it may be, because there's still that stigma with mental health and addiction. So we are obviously, out here, chanting, stigma free and talking to people. And the more that we talk about it, the more that we destigmatize it. So even with our Narcan trainings, we tell people, you could save a life. You're not carrying it because you're going to overdose, because if you overdose, you can't Narcan yourself, right? So you're carrying it because you could save a life. So we're trying to destigmatize, addiction, make sure that people know that, we're here to help. And I think we've done a really good job at that. 20,000 contacts later, over 4,000 Narcan kits later, and now 96 hub clients later, we're able to create those relationships with this really amazing team. Because we have a recovery specialist with us, and we have a mental health professional with us. So, we are the boots on the ground, and we are seeing what, who's in the community, what the community is struggling with, and what they need. And, we're on the same note, we're seeing, that stigma, and that those family members who are scared to say anything because of the stigma. So
Exactly. And that's and my phone unfortunately broke off, but you were saying that. So you guys are doing it as numbers now if they do request it, right? And they don't want anybody to know, right? Is that what
it doesn't matter. Yeah, it doesn't matter who it is. They're a situation number.
Yeah,
Okay,
that's it, Jennifer, just to make sure, and again, you can listen to the video, but it's always a number. The names are never used, correct, Erica? So it's always assigned a number, not a name.
Correct.
That's okay. So it's okay. Yeah, because I asked because it's just one of those things, and I come across it a lot. And I tell people, I'm like, because I didn't know that we were starting to do numbers yet. But I'm always like, wouldn't it be better for them to be alive, But I feel like some people just rather, it's like reputation. I feel like a lot of times people care more about it in some ways, even though they don't, but they do. So that's why I asked that question.
Sure.
That's a great question. And Jennifer, I just want to bring up another kind of a piece of the puzzle that might not necessarily be Hope Hub, but I'm sure Erica would back me up, is that oftentimes because of the stigma, the isolation is devastating to family members who are fearful about a loved one they're concerned about, or who one is struggling. And I would just encourage everyone to check out, call Family Partners if you're not sure what support groups are out there, but there are support groups supporting people with loved ones who are struggling with these things, because we really need to, not only is the individual struggling, but those who care for them are also struggling. It's a very big burden. It's a very big stress, but hopefully with programs like this and with Erica giving presentations like this, we all can become braver and accepting of the fact that these are illnesses. These are challenges. This is not a judgment of character. Thank you for the heart, Jennifer. I see that. I mean, there is so much to be gained by us joining forces and having these difficult conversations, because they don't go away when we don't talk about them. They get worse. So I really, Family Partners is such an amazing organization. We offer support groups for families with children who have challenges, but for moms, for dads, in Spanish, for youth, because the main reason of what we're trying to do is break that isolation, because we all have different struggles, but guess what? No matter what it is, the isolation is in common. We all have that fear of judgment or fear of making a situation worse. And as Erica said, don't be afraid to reach out to these resources, because I have such, like I said, I teared up, but seeing people at the table who say, here are the challenges, who can help best. I have every confidence that anyone I've ever met in Morris County, Sussex County, and beyond in this line of work, we're in it to help the individuals. We're in it to really come together. So Hope One, I mean, Morris County keeps cranking out these programs. One's better than the next as far as just helping us help one another in a community, because, call me a sappy one, but I believe in my heart of hearts that we all want to do that. We just need to know how. And so, Erica, I really appreciate the time today. And any parting thoughts? Like, I mean, you couldn't have made it easier for us with the QR code, with the website. I mean, there's a lot of information that we'll send this video out, but if folks just tool around on the internet, I'm sure they can find more details about the program and resources, correct?
Absolutely. We have our Hope One page on the Sheriff's Office website. We have our Hope Hub page. The Hope Hub page has the link on it, so you can, grab it right from there. And we're here and we're all working together, and we appreciate, you guys talking to us, listening to us, becoming part of the hub, because that's what it's all about. It's all about making our community better, and that's what we all do. So why not work together so that we can successfully, get these people that are struggling, individuals or families, the help that they need.
That's great. And I think I've also seen schedules published, right, Eric? I think even like with your other, there's usually where you're going to be on what day. And I'm wondering, do you, Christine, do you have another question, or is your hand just raised from before?
No, I do have one other question that,
Okay.
that like with DIFUS, right? So, years ago I saw that if somebody doesn't say I see an incident and I'm just a person on the street and I see an incident, it's said in the DIFUS handbook, like if I don't say something, or if any citizen doesn't say something, you can get like $1,000 fine, 30 days in jail. Like, just basically it means like we're all responsible if we see somebody, like if we see something that happens, not to turn our head about it. And I don't know exactly where I was going with that part of it, but it's like people, so people don't, the general public doesn't know that. And I feel like the general public, like, you're educating us. It's wonderful. The word's getting spread around. And like, how do we get the community to know this? Because that seems to me, even for myself, my own challenges with my family and things, I worked as a social worker and I had this much information. Like, there's so much out there, but it's people don't have the information. And it's great, like, we're getting it out there, but like, how do we, I mean, I know they do, like our town does the Parsippany Patch, and it tells you all the things that are going on. And they do have, I think it's like coffee with a police officer. So I was just thinking, like, that might be two ways. Like, how do we get the general public to know about this, so that people, and that we are, we with DIFUS, like with child abuse, or like, if we, like, to get the community to know, like, if I do see something, I'm responsible to say something. And how do we get people to know that this exists? Like, we know now, but how do we get the community to know that? That's where I'm going.
Sure. So we are out, we're grant funded right now to operate 5 days a week. with Hope One. Hope One is our mobile unit, so we're out in the community every day. Today we are at the Rockaway Mall, so we are always spreading the word about the Hope Hub, about the services that are available here in Morris, and to help, get Narcan into the community because it does save lives. So that's our mobile model. We also do post it on our Sheriff's Office Facebook page to get the word out to our community, the people, all of our followers here in the county, so that they know that these resources are available.
And I would say too, Erica, it's interesting to me because we had a speaker twice actually from DCPMP recently, who, it's so interesting that the old concept of someone getting in trouble and a youth being ripped from the home and, just like not positive images. When you hear individuals presently talking about what their focus is, it's very different. It's more about if you have a concern for a neighbor, for instance, you're not calling to get them in trouble. You're raising a hand and saying, I think they need help. Like I have been so, inspired and appreciative of that attitude. We've had Ben Davies from DCPMP speak with us twice. And really that was his message this is not like you said, Erica, we're not slapping wrists. We're not being punitive. We are identifying an individual or a family who needs assistance. And it behooves everyone to approach it that way instead of from a situation of getting somebody in trouble, right?
Yeah, and thank you for what you do. Thank you for doing this. I see so many. We all know people who have, lost loved ones to alcohol, or drugs, or mental health. I wish this was around. I fostered my nephew from 15 to 18, and I think, oh God, I wish they had this because he just kept getting in trouble, but he just really needed help. So thank you for what you're doing to help people. And I have seen the truck around, so thank you for being out there in the community, and helping people. It's wonderful. Thank you.
Well, I'm going to say to everybody on this call, don't be shy to go and say hello to Erica or to Chelsea. I'm sure they would like a hello. And you know what, folks, when you get this video, if you want to share it with a colleague, with a neighbor, with a friend, please, we need to have these conversations about wonderful things that are happening and how we have resources that are available that families just often don't know about. So I'm going to say, don't be shy. I'm going to say also, we just need to offer a helping hand, right? Instead of judgment or looking down our noses at someone who's struggling, because usually they're struggling because they're having struggles, right? It's not a character judgment. So I see no other questions. Erica, you've got me. This is gets me in such a good mood for the day because I just love, I love when we see people using their smarts and their hearts to benefit the community. And I can't imagine how good it must feel doing the work that you folks do, because you must see the difference that you make, right?
It's amazing. It's amazing.
It's amazing.
To be able to go out. Yes.
Well, thank you for all that you do. And we know that spread the word about good things happening, not only in Morris County, but I know Sussex County has wonderful programs too, where our officers are seeking first to understand and helping to support folks who are struggling. And never be shy about asking a question. If you don't know who to call or what to do, we have the information for Hope Hub, but Family Partners is also here for you. We don't always have the answers, but we are very tenacious about finding the answers and making the connections, because I have great faith that this is the direction that we're moving in as a community and as a nation, hopefully, is that we understand we're not going to get through this individually. We need to lean on one another and learn what helps and what supports. So Erica, thank you so very much for being here. And Chelsea, who is the coordinator of Hope Hub, was great in setting me up with all this information. And everyone, look forward to the video. I will be sending it out along with key resources for you. And reach out to Erica, reach out to Chelsea if you have questions, or if you want to see a list of the organizations that are already on board. Maybe if there's somebody that they've missed in some way, we'll make sure that they connect, because they are very interested. So everyone, Erica, are we done? Are we good?
Thank you so much.
Okay, thank you, Erica, for your time. And everyone, thanks for making time for us for Lunch and Learn. We hope to see you again next week. Stay healthy, everybody.
Thank you.
Bye-bye.
Oh, hi, Krista. Hi. How are you?